By American Heart Association news, women are less likely than men to receive bystander CPR in public and far more likely to die afterward, according to a new study. Researchers analyzed 19,331 cardiac events that occurred between 2011 and 2015 and released the preliminary results Saturday at American Heart Association's scientific sessions. CPR involves pushing on the chest so that could make people less certain whether they can or should do CPR in public on women, said Audrey Bluer, MPH, the study's lead author and assistant director for educational programs at the Center for Resuscitation Science at the University of Pennsylvania in Philadelphia. The data for the study was compiled by the Resuscitation Outcomes Consortium, a network of regional clinical centers in the United States and Canada that study out-of-hospital treatments of cardiac arrest and trauma. The preliminary results they released showed 45% of men received bystander CPR in public settings compared to just 39% of women. By the time men were discharged from the hospital, their odds of survival were 23% greater compared to women. The disparity narrowed to 35% of women and 36% of men receiving CPR when the emergencies occurred at home. There was no significant statistical difference. Ultimately, this highlights a key knowledge gap in resuscitation science that we need to characterize the bystander to better understand the barriers and biases to CPR delivery. This can help inform public messaging and public CPR training, said Bluer. Disparities for men and women exist throughout healthcare, experts say. Studies have shown that gender disparities exist in cardiovascular disease, as well as response to time-sensitive conditions. To our knowledge, no study has examined whether gender variation exists with receipt of layperson bystander CPR, Bluer said. According to a study released last year, women are less likely to receive several different potentially life-saving procedures after cardiac arrest. That research showed women were less likely to receive coronary angiography, which can be used to look for blocked arteries, angioplasty, which is the repair or unblocking of an artery, or to have the body temperature lowered to increase the chance of survival, reduce the risk of brain damage. Some of the problems begin early in the process. While heart disease is the #1 killer of women, only 1/3 of all heart research subjects are women, even though genders exhibit different symptoms and reactions to medications, treatments and medical devices. As long as women are underrepresented in clinical trials, we will continue to lack data to make accurate clinical decisions on 51% of the world's population, said authors in a specialized women's issue of Circulation Cardiovascular Quality and Outcomes in 2016 that drew attention to the issue. American Heart Association News Stories. American Heart Association News covers heart disease, stroke and related health issues. Not all views expressed in American Heart Association News Stories reflect the official position of the American Heart Association. Copyright is owned or held by the American Heart Association, Inc., and all rights are reserved. Permission is granted at no cost and without need for further request to link to, quote, excerpt or reprint from these stories in any medium, as long as no text is altered and proper attribution is made to the American Heart Association News. See full terms of use.